Port Moresby General Hospital's Director Medical Services, Dr. Kone Sobi, says there is a slow decline in the number of COVID-19 cases reported at the hospital.
We are seeing a slow decline in the number of positive cases, but there are still many very sick patients with COVID-19, particularly those with diabetes, hypertension, and other illness. And so they will require a lot of health support, clinical support, in coming days or even weeks.
Currently, there is about 150 patients at both the Port Moresby General Hospital and the Tauranga Aquatic Centre.
At the moment, including Tauranga Aquatic Centre, we have around 150 inpatients, and about 60% of these patients require oxygen. So that's a huge demand on oxygen for this number of patients we have in the hospital.
Dr. Sobi said hopefully with the slow decline in the number of cases, they can be able to accommodate patients that have been attended to outside at the triaging area. Last week, the hospital opened a new COVID-19 ward to cater for the increasing numbers. However, with the numbers slowly dropping, they hope to recoup and prepare well for the next wave when it hits.
And hopefully with this gradual or slight slow decline in the number of cases, we can be able to accommodate all those patients in our ward capacities, including Tauranga Aquatic Centre. The last thing we want is to continue to have patients being nursed at the triage tents. Those facilities are meant for immediate diagnosis and holding for a couple of hours and then transfer to the wards. But at the peak of the surge, we were just full capacity and we could move these patients elsewhere. So I believe this move is also preparing us, hopefully, for next surge.
Meanwhile, new data released by the National Department of Health as of the 4th of November, there were 277 new cases reported. Total number of accumulated cases is 31,287. From that, 28,354 have fully recovered. No deaths were reported. Also, as of the 3rd of November, a total of 177,550 people have been fully vaccinated. That is only 9.5% of the population required to get the jab.
Really careful, abiding with all the measures, the nuclear passing, avoiding social gatherings or mass gatherings, and not keeping up with vigilance and improving our vaccination coverage. We might potentially see a worse surge than what we have gone through in the city.
Shamin Poriambab, National EMTV News.